Brand new edition of Health Talk, and we have, of course, we had Jeff Fee last week, the CEO of Providence Health and Services. But today we are privileged to have a prominent physician here in town. It's Dr. Joseph Knapp. He's the cardiologist who specializes in echocardiography at the International Heart Institute of Montana at Providence St. Patrick Hospital. Dr. Knapp, how are you? Welcome to the show.
I am great, and thank you guys for having us here today.
Can we call you Joe?
Please do.
All right, good. All right. First of all, tell us a little bit about yourself and what you do. Well, first of all, what is the International Heart Institute?
That's a great question. We were talking about this just before the show. The Heart Institute is a collaboration between the University of Montana, which a lot of people don't realize, between the University of Montana and St. Patrick's and Providence Health Systems that dates back almost 25 years and is a collaboration that involves cardiovascular surgeons, cardiologists, research activities, educational activities that are all part of this collaboration. So we have an obligation to serve really to provide a vast array of cardiovascular services throughout western Montana. That's really our charge and task. And we've been at it now for a quarter of a century pretty remarkably.
I do know that there have been, of course, I think every year you have a special symposium, right?
We do.
At the IHI, and distinguished surgeons and medical professionals from literally all over the world come to Missoula, right?
That's true. And this will be our 25th year. We're talking 25 years. This is the 25th year of the symposium. The first three were actually done in San Diego, but since then, they've been done here in Missoula. And the end of July, we'll have a 4-day session with prominent speakers, but also participants literally from all over the world. We've had them from literally every continent, with the exception, obviously, of Antarctica. But we've had pretty much everybody else well represented at times over that 25-year history.
What are some of the services that the International Heart Institute offers? Obviously deals with the heart, but I'm sure there's lots of related scientific studies that go along with that. Is that right?
Right. And we are short of some very sophisticated things, and I'll speak specifically things like heart transplant, can provide pretty much the full array of cardiovascular services. We've got a full array of cardiac surgeons. We have cardiologists who specialize in procedurally related repairing of heart valves and heart arteries, better known as stents and implantable valves. There are people like me who do predominantly patient care on an office basis, as well as various forms of heart imaging. We now image the heart with sound waves. We image the heart with or X-rays, basically. We also image the heart now with magnetic resonance, MRI scanning, kinds of things. You think about MRI scanning, you think about things like knees and hips. We do it with the heart as well. We do a lot, and we also do it with nuclear imaging. We do it also with what's called positron electronic transmission, or PET imaging as well. Bottom line is that there's a whole array of different tools. They talk about, the one who really succeeds is those who have the most toys. Well, I will tell you that cardiologists are blessed with an array of toys that are just almost incomprehensible to the average person. We really have quite a load.
All right, we're going to take our first break. 721-1290 is our number, 1-800-568-5309. Dr. Joseph Knapp is with us. He is with the International Heart Institute of Montana at Providence St. Patrick Hospital. If you have a question or a comment, give us a call. We'd love to hear from you. 721-1290 is our number. Now, remember, Dr. Knapp's only going to be with us till 9 this morning, so get your call in at 721-1290. We'll be right back. And we're back on Talkback. It's actually Health Talk, sponsored by Providence Health and Services, Western Montana. Dr. Joseph Knapp joining us this morning from the International Heart Institute, and we already have a caller wants to visit with Dr. Knapp. So, Tracy, good morning. You're on.
Good morning. So, I have a question. When my daughter was 6 months, she had open heart surgery over in Seattle, and then later we had to do a pacemaker and stuff. But I was reading this article a short time ago, and it was a really short article, and it talked about a pacemaker that goes in through the artery in the groin and it gets put in that way. Do you know what I'm talking about? Have you seen anything on that?
Yeah. Hi, Tracy. Joe Knapp here for you.
Hey.
Yeah, the answer is yes. There are historically, pacemakers have been these fairly big devices that get put in under the skin, look like a little tin can, quite honestly, attached to a wire that goes into the heart, and that's been pretty standard fare, becoming smaller and more technically complicated over time. But very recently, and we don't have the ability to put them in yet, but they're coming. They have these little devices. They look more like a small capsule that can truly be implanted right into the heart through a small incision in a leg blood vessel, like you're mentioning, that will likely in the future replace these big, larger devices that are attached to wires and all. It's just the natural sophistication of electronics that, anybody who knows about electronics knows that the world of electronics has just exploded. That same technology applies in the world of pacing. If you think about pacemakers, they really are nothing more than an electrical system, and they allow because they're really important to keeping the heartbeat on a regulated basis. This is really very much like anybody like me who had one of the original cell phones know what carrying a 5-pound device around in your hand is like.
Yeah.
And you compare that to now, that's exactly the kind of changes that are happening in pacemaker technology. So in the not too distant future, somebody like your daughter who requires a pacemaker, well, rather than having these big clunky devices, will have a very small device implanted into the heart.
I know when we went to Seattle when she was 6 months old, and she's 14 now, so it's been a bit of time. They did the open heart surgery. She had a hole in her heart, in the lower atrium and stuff.
Right.
So, and we left a week later. Her heart went into sinus rhythm and stuff. So we left, and then it slowly went out of it. They figure scar tissue built up around the patch they put in and blocked the conductive system,
Right.
is what they figured. I mean, it's hard to... But anyways, when we were there the first time, when she was 6 months old, they had... she was in heart block for like a week, so she had an external pacemaker, and they thought, well, if we don't do something tomorrow, if she doesn't get better, then she was scheduled to have a pacemaker put in then. And at the time, it was big one that went in the abdomen,
right,
where they would have had to crack her back open again but 3 months later when we went back, they had come out with that little infant one that was, the size of maybe a 50-cent piece.
Right.
And they put that up below her collarbone where
Right.
they go now, So just in that 3-month time, it went from a gigantic one in the abdomen to the little small one below her collarbone.
Tracy, how's she doing?
It's crazy.
How's she doing today?
Oh, you don't even know it. She has the bigger 2-lead one now, and the only time we know that she has one is when we have to do our every other month over the phone check and stuff. Other than that, she's doing. Yeah, there's certain things she can't do, like tackle football, but I doubt she's going to do that. So. Just a few little things, but other than that, she plays soccer. She plays, softball. We have a little pacemaker guard that goes over that for softball, just as a precaution.
Right.
But she's doing awesome.
And what you're experiencing with your daughter, and you'll see as time goes on, is the true scientific revolution when it comes to both devices, but also just the overall world of technology. One of the neat things about medicine in general and cardiology in particular is that we really are an intersection between really basic technological, sophisticated advance and dealing with people. I have a very luxurious job in that I get to be a real techie at times and a real personal person at times. So we're very fortunate in that standpoint that we deal with people, but we can also use very sophisticated technology. So it's a really fun thing to do. And I think your daughter is right smack dab in the middle of a true technological evolution and revolution in cardiac care. And you'll see advances that are just startling as she ages.
Yeah, the pacemaker she has now, they're how you hook them all up at the office, and this one tells how much battery life is left, years, months, and days. It goes all the way down to that and stuff, and So if everything goes like it's been going, it'll be another 4 years before she needs that replaced. So I'm sure there's going to be tons of changes by then.
And I can tell you, Tracy, that the likelihood is the next time she gets her pacemaker in, her checks will be done through her cell phone.
Oh, really?
Seriously, that's where the world is going.
Yeah, Dr. Hardy is her cardiologist because she's, he's a pediatric cardiologist around here, as you well know.
Right.
He was saying that they were working on rechargeable, because on the pacemaker, you're basically, my understanding is all you're doing is replacing because the battery's wearing out and stuff.
Hey, Tracy, well, listen,
they were talking about that.
We're up against a break. We appreciate
sure.
your call. Thanks so much for sharing that information.
You bet.
You
Thanks.
take care, and best of luck to your girl. We're going to come right back with more with Dr. Joseph Knapp. This is Health Talk, and we'll be right back. And we're back on Talkback. 721-1290 is our number. This, of course, is Health Talk, sponsored by Providence Health and Services, Western Montana. Peter Christian, John King, and Dr. Joseph Knapp joining us. We have a Facebook question.
That's right. Katie wants to know about nutrition and heart health. She says John Hopkins has done studies on the efficacy of supplements to mitigate heart disease and concluded that they were not effective. Do you agree or disagree?
Well, that's a very complicated area, and it remains an area that we're going to have to spend a lot of time looking at. And I'll give you an example. One of my partners, Dr. Brad Berry at the Heart Institute, deals with people who have a condition called chronic congestive heart failure. That's a condition where the heart just doesn't pump very strongly. What he started just a couple of years ago was really looking at some of the areas of supplements, because supplements have been given more credit than due at times, and they've also gotten a bad rap at times when that has also been not fair. What Brad did was start looking at the benefits of vitamin D in particular, and what we're now finding is that there is a clear-cut role to play for vitamin D in people who have significant heart muscle dysfunction. So the answer is very, very complicated, and it's not simply a yes/no kind of a deal. It's like everything else in life. It's rarely as simple as you want it to be. I'll tell you my personal approach towards supplements. Generally speaking, the average American who eats a reasonably nutritious diet will do plenty fine in general. However, if you want a little bit of extra assurance, there's really nothing wrong with taking an appropriate dosing of supplements. At the same time, though, there are individuals who take it to the extreme, and supplements are not entirely innocuous. There are side effects, especially if you overdo. I mentioned vitamin D in particular. One can actually get toxic from too much of something. So too much of a good thing can oftentimes be harmful. So I'm not going to say that give you any kind of a general sense, but I do think that we have a lot to learn going forward that we don't presently understand, where supplements will probably play a role in certain areas. But that means still applying the scientific rigor of actually looking at things rather than just assuming that things work based upon what somebody says. It's actually applying the scientific rigor of actually looking to make certain that things do provide the benefits that they're touted to give.
Okay, let's get a quick call in with Bobby. Bobby, you're on with Dr. Knapp. Go ahead.
Yes. Hi. My husband had a heart attack 6 weeks ago, and he was put on Plavix and Lipitor. Now, what I would like to know is if he has blockages, say, or plaque buildup in his lower extremities, is that going to help clear out some of that, or does that not help that, or what?
Yeah, it's a great question, Bobby. Those of you who don't know, Lipitor is one of the cholesterol-lowering medications. We call them statins. And there's a number of different versions of statins out on the market, Lipitor being one of them. What Lipitor actually does is not just work on heart arteries that have either been plaque-laden or worked on like Bobby's husband's were. It works throughout the entire vascular system. So in regard to plaque buildup in the leg circulation, or what we call the peripheral circulation, it is as effective there as it is in the heart circulation. An interesting side note, when one looks at some of the things that we do after people do have heart attacks, she mentioned Plavix, we also use aspirin in these individuals. We know that if we combine these particular medications, blood thinner medications like aspirin and Plavix, And the statin drugs like Lipitor or Zocor, and there's a number of others. If you start people on these drugs, they not only lower cholesterol, but they actually cause plaque that's built up in blood vessels to first stabilize, and then, if given enough time, to very slowly begin to regress, meaning you can actually take that material that's rock hard and built up in blood vessels and gradually begin to remove it. And we're talking very gradually. We're talking like a 1% reduction in the amount of plaque in blood vessels on a yearly basis. It's a slow, relentless process, but these drugs really are pretty remarkable.
And that's why you have to keep taking it, right?
That's why you got to keep taking it. And, when I started in this business 30 years ago, the statin drugs were just really kind of a thought on the horizon. And the same thing with blood thinners. We were just starting to understand their benefits. And we've watched the incidence of heart attacks and fatal heart attacks and recurrent heart attacks drop precipitously over the last 30 years, predominantly because of the benefits of some of these pharmaceutical agents, as well as some of the lifestyle changes that people are now doing. The level of smoking, for example, in our communities and in our society has really dropped dramatically over the last 25 years. So, there's some things that happen rapidly with technological change. There are other things that take a very long time to make an impact, but they're beneficial in the long run. And the Lipitor kind of blood thinner combination is an example of a long-term strategy to decrease the likelihood of subsequent events, and they work.
Hey, Bobby, thanks for your call. We appreciate it. We'll take another break. Come right back. 721-1290. Dr. Joseph Knapp sharing his expertise from the International Heart Institute. We'll be right back. We're back on Health Talk. 721-1290 is our number. Dr. Joseph Knapp with us for another 3 minutes. And so I didn't have a chance to talk to you about something called echocardiography.
Sure.
So tell us what that is.
Well, it's very simple. It's using sound waves to image the heart. And just like any woman who's had a child knows that ultrasound is used commonly to look at babies in the womb. Well, we've looked at the heart with ultrasound for now nearly 50 years, and it is a remarkable tool. It is, as best as we know, innocuous in the sense that sound waves don't have any substantial risk to individuals. It's a great way to see the heart in actual what we call real-time motion. We now have the ability to image it three-dimensionally, which is truly striking.
What's the hierarchy there of what you start with? Start with a regular X-ray, and if that isn't enough, then you go.
That's a great question, Peter. We start with an interview, and I think this is before we even get into echocardiogram. I'm going to talk about the basics here, which is that. The reason for most of these tools, whether they're X-rays or ultrasounds or lab tests, is as much to confirm what our suspicions and our interview time tells us. And I think oftentimes we get kind of waylaid into this thinking that the technology is the be-all and the end-all. And I want to go back to one of my first comments, in that medicine in general and cardiology in particular remains a human interaction. And we, as providers, as clinicians, get most of our information from what people tell us vocally and what their bodies tell us when we examine them. And all of these tools are just adjuncts to that. They really kind of help us really either confirm or refute what our first thoughts are. For the world of cardiology, the echocardiogram, because it is such a easy to use tool, transportable. Now echo machines are literally as big as I get back to the cell phone analogy, literally as big as a cell phone. We can literally take it anywhere. I actually travel and have over the years worked in Africa and in some very remote areas. And it's the tool we take with us to image anywhere in the world. You don't have to be in a big city or in Missoula to use it.
We have less than a minute to go, so I want to get some contact information for the
Sure.
International Heart Institute, Dr. Knapp. So how do we contact you folks and,
Okay.
take it from there?
A couple of simple ones. Phone number is 329-5615. That's our local phone number here. We'll get you through to our office staff. We can be reached through the internet just by go to any search web or web engine you want to use, and just type in International Heart Institute, or IHI Montana works as well. Those are probably the two simplest ways to get a hold of us.
Dr. Knapp, thanks for being with us. You're welcome anytime.